Dr. Wayne McCarty, could you describe what type of injuries that you're helping people with primarily?
Let's say you had a car injury 8 or 9 years ago, or even longer, or an old sporting injury, and it never quite healed properly, and you've been in chronic pain for a lot of years. You may have tried a lot of soft tissue therapies, massage, physiotherapy, acupuncture. No doubt all these things have helped you, but it doesn't heal, and so the pain keeps returning. This is where prolotherapy can be very effective. So it wouldn't matter if the injury occurred 3 or 4 weeks ago, last week, or 10 years ago. Prolotherapy is still valid. And essentially what we're doing is we're just finding where the damaged ligaments are and we're bringing them back to full strength with injection reconstruction therapy, which is prolotherapy. Prolotherapy means proliferant therapy. So when we inject that damaged tissue, we bring it back to full strength. That means that your muscles can now pull very hard on the joint and the joint will not hurt. So knee injuries, low back is very common. Rotator cuff probably is the next one that we see a lot of. The effect of the treatment takes 3 weeks because it goes through a cycle of inflammation and then repair, and that takes 21 days. So typically we do the treatments 21 days apart. And for most conditions, it might require anything between 1 and 30 treatments. On average, we find somewhere between about 2 to 4, maybe 6 treatments for any given condition. Once that strength has been re-established, however, the effect is permanent. So it's a permanent solution for old sporting injuries or any accidental injuries. Typically with accidents, what people have done is they've either fallen, usually while they're carrying a load, or they've twisted, usually carrying a load, and they've felt something pull, and from that date, even though they've had all kinds of treatments, the pain just really doesn't go away and it just keeps coming back. If that sounds like you, you might want to look at prolotherapy. It's over 90% effective. This has been proven by many, many studies.
So this could be runners who've worn themselves out and they're told you need a replacement knee or a hip.
A lot of our people have been x-rayed and it shows that there's diminished thickness to the knee cartilage or the labrium or cartilage elsewhere in the body. By injecting prolotherapy, we can get the chondroblasts to start to produce more cartilaginous tissue. And then on future x-rays, we've seen the joint space increase. And the only way that can happen is because the cartilage has grown back. So essentially, prolotherapy is a very good method for treating diminished, thin, or torn cartilage. Or if you've had a knee operation and you've had some cartilage removed, you might even have bone on bone. But this is where prolotherapy really shines. So it's worth taking a look at. Remember, if it doesn't work, it will not cause you any harm.